Greetings to one and all present here. My name is Amola Srivastav and I'm here to present a research paper on security threats in healthcare system. It is a bibliometric study. I have co-authored this paper along with my mentor and professor Dr. Saikat Gochait. So looking forward, what exactly are the security threats in healthcare system? As we have studied, in the cybercriminal world, health data is a very valuable asset, making it a target for hacking. All the healthcare organizations are likely to pay huge ransomware because of the well-being of patient is at very much risk. So this research we have done using bibliometric analysis. Bibliometric is a statistical method for determining the relative value of scientific performance in a given area. So here we will use this analysis to study the different papers on the healthcare systems and security threats that they are currently facing. Along with this, we will also analyze the threats in the cybersecurity in the healthcare industry which have a possibility of occurring in the near future. So the primary focus of this research paper will be on security risk assessment for healthcare management system and user framework. Furthermore, we'll dwell deep into the primary goal of the bibliometric study, which is to provide a method for estimating the current level of the risk assessment. This paper also discusses the various types of cyber threats and the approaches which can be used to minimize them. So, as we have seen that during the COVID-19 pandemic, it was also highlighted that the economic effect of cyber attacks on various organizations and on their critical infrastructure, along with hospitals and healthcare, was one of the most targeted infrastructures. Moving on, we have seen that in the past decade, the seriousness and the frequency of healthcare data breaches have immensely grown, with the major breaches impacting as many as 80 million people. 6.8 million information breaks in the India's healthcare sector have occurred in the last few years. And according to the Breach Barometer survey, a number of data breaches discovered in the 2019 rose by 48.6%, which is very huge. In the new era of Internet of Medical Things, as we say now, the electronic health records or the EHRs have become more vulnerable to data breaches when exchanged via an external entity or over a network. When we look at the healthcare sector in India, it is expanding at an unprecedented pace, especially during the last 2 years. We knew how weak our healthcare system was and took the proper steps to make it grow. This industry is rising at a rate of 15.92% per year. And if continued at this rate, it will be a $55 billion industry by the end of this year, which is 2022, making India the world's sixth largest market. This stresses on the importance of safeguarding patient data, medical records, diagnostic information, insurance records, and billing information. Now coming to the methodology that we have used. We used the VOS viewer to analyze over 50 plus research papers on this very topic, including cybersecurity, security threats, healthcare in India, healthcare internationally, healthcare workers, devices, internet, authentication, authorization, so that we could come upon a framework. And in order to investigate these various clusters for finding the best security threats in the healthcare system, we used a systematic method to identify the relevant scholarly resources. The search query for the Web of Science online database begins with the words in the title or keywords. So after logging into the Web of Science portal, we use these keywords. And several different word combinations can be used in the search query, just like I mentioned. The fundamental study shows that the evolution of research in this area over the last decade, that is from 2010 to 2020, the bibliometric review collects the title, author, abstract, keywords from various published research work. It then provides a competitive analysis of the keyword occurrence and mappings, how frequent a keyword has been used in research paper. And VOS viewer is used for this cluster formation of keywords. The method used for analysis is association strength, where the world got total link strength as 1 to 1679. For the 1500 papers taken, binary counting method was used, where the world got total of 4 clusters. And the image presented here shows the clustering that was provided by the VOS viewer. Now let's delve deep into some of the basic areas of research that we have done. The first one being the blockchain in healthcare sector. As we know that blockchain is flourishing, especially with the release of metaverse recently. We all know that metaverse will be built upon blockchain, and if the entire system comes onto metaverse, blockchain will be one of the fundamental technologies which will continue into the near future. So the combination of blockchain and smart healthcare will significantly mitigate traditional smart healthcare pain points in knowledge sharing, data protection, privacy upkeep, and simplify operator-centered smart healthcare structures. It will also create a cooperative medical association chain concerning the administration, businesses, and persons to facilitate the smart healthcare industry enhancement. At this time, blockchain has piqued the interest of the entire industry. Secondly, we come on to the authentication in the healthcare system. All the sensitive medical data related to the patient's health must be protected according to the Health Insurance Portability and Accountability Act, also known as HIPAA. Data aggregation is a method of gathering and aggregating data from sensor nodes, and it is one of the most important procedures for not only eliminating redundant data but also conserving the resources. However, data aggregation scheme faces a number of security issues that must be carefully handled. And the latest advances in the field of IoT, or the Internet of Things, shows that a lot of potential in terms of offering healthcare solutions. However, IoT based healthcare systems maintaining data privacy and confidentiality while aggregating the data is still a common challenge. Lastly, coming to sensitive data. We know how sensitive and vulnerable our healthcare data is. The healthcare industry has created a simulated and wired environment of clinical devices that transmit this unstructured and potentially unsecured data on a continuous basis, because our healthcare workers are not as technologically sound as they should be. In reality, due to poor design and frail authentication steps, an attacker can intercept this network. And owing to this inability to identify and prevent such attacks, another security issue is the potential gain to unauthorized access without being detected. As a result, the invader can remotely manipulate drug doses and transform IOMT sensors and botnets for a DOS attack, which can be very harmful and even fatal in some cases. Let's have a look at the conceptual framework of the security threats in the healthcare system. So the main goal of this framework is to elaborate on the security situation, aiming for continuous improvement and eliminate the communication risks. Firstly, the exchange of information between the health agencies is an important aspect of the healthcare delivery. A modern healthcare system must ensure that security of all communications, whether they are digital or analog. In the healthcare industry, email and fax are also two most very prevalent communication methods. Secondly, hospital and other healthcare facilities are embracing a more holistic approach, which is called enterprise risk management, to expand the role of risk management across the enterprise. So ERM encompasses standard risk management elements such as patient safety and medical responsibility, while also including a big representation approach to risk across the enterprise. The ERM encompasses of 8 risk domains, which are operational, clinical, patient safety, strategic, financial, human capital, legal, regulatory, and technological. Also environmental and infrastructure based threats. These are very prevalent. So the risk management plan should be put first and foremost to include the education and training of these employees. It needs to give detailed preparation requirements, which should include orientation, ongoing and in-service training, and event-specific training. Measures for recording and reacting to patient, family and grievances should be described in the risk management plan to increase patient satisfaction and limit the possibility of litigation. The plan should also specifically state the goals to diminish any obligation entitlements, custodian events, and the cost of organization's risk should be well expressed. Contingency plans should be unfavorable system-wide failures, and disaster situations should be there, such as faulty HR systems, security breaks, and cyber assaults should also be included in the healthcare management strategies. Lastly, I would like to say that the healthcare management strategy should be a live document that is updated and enhanced on a regular basis to reflect the new risks, teachings gained, new information, fluctuations in the healthcare system and in the medical practice. With these updates and modifications as and when they are made, the strategy should include provisions for communication and training. Coming to the results of this study. The bibliometric analysis brought an original and thrilling topic to understand the security threats in healthcare systems. By applying this strategy, new findings have been observed in the field of healthcare with the interface of technology. The healthcare risk management strategy should be a live document, as I already mentioned. When these updates and modifications are made, the proposals will provide communication and trainings for the provisional basis. Thank you.